Hey everyone, I'm glad you're here. This is Coffee with Casey, my weekly live Medicare training where we dive into critical Medicare topics that need to be shared and often aren't talked about, at least not until it's too late. So, I have a quick question for you. Have you ever heard someone say, my Medicare plan seemed affordable when I started, but then it got really expensive? It happens a lot more than people realize. And today I want to walk through why that happens because it's not random. If you're on Medicare, if you're getting close, or you're helping someone who is, type close in the comments. We haven't met yet. My name's Casey Album. I'm the senior Medicare advisor at the Album Insurance Group here in sunny Margate, Florida. We've been in business for over 30 years. We've helped literally thousands of people enroll in Medicare and choose the right coverage here in Florida, where we're based, and all throughout the country. I help people navigate Medicare and design a strategy that fits their life today and for years down the road. Many of my clients refer to me as their Medicare co-pilot, not just because I fly, I am a licensed pilot, but because just like flying, your Medicare journey needs a plan before you begin. And the reason I'm the co-pilot, you're the pilot, it's your journey. I'm just here beside you to guide you along the way and help you steer clear of turbulence and bad weather. So today is about helping you understand how costs actually behave over time so there are no surprises. And this is Coffee with Casey, so grab your coffee or your favorite afternoon beverage and let's get into it. So we're going to keep this simple. I'm going to walk you through why some plans start low and then get really expensive later on. I'm going to talk about what's actually driving those increases, and I'm going to show you how to think about this the right way when choosing a plan. If that sounds helpful to you, type me in the comments. So let's start here. A lot of plans, even the ones you see advertised on TV, they're designed to look very, very attractive up front. Low or even zero premiums, extra benefits, simple messaging, celebrity spokespeople. And for many people that works at first. But what you're often seeing is just the starting point, and you're not seeing the long-term picture. A low premium or zero premium today doesn't tell you how that plan is actually going to behave over time when you need to use it. Now, let's talk about what actually drives costs up over time. There's a few main factors at work here. Number one, healthcare costs are rising. There's more healthcare usage, especially coming out of the COVID years as all of those elective procedures got put on hold. Higher costs of care. There's new treatments. New treatments always cost more. And that affects all plans. It affects Medicare, but it's not always equal. Another factor is how the plan is structured. If it's a network-based managed care plan, an Advantage plan, you're typically going to see lower upfront costs, but then you're going to have more cost sharing as you go to use services. Things like copays for specialists, the inpatient hospital stay copay. That's something most people don't ever think about, by the way, that few $100s a day for anywhere between the first 5 to 10 days of an inpatient hospital stay. A lot of people don't realize that that's charged on most plans. And then you've got a couple $100 for outpatient procedures, tests, things like that. And these out-of-pocket costs, they can add up over time, and you typically have to reach a maximum out-of-pocket limit before you're covered in full. Well, with those plans being zero premium, what's actually happening is you're opting out of original Medicare. You still got to pay your Part B premium. I know that, so they're not free. And what happens now is that plan gets paid an annual amount by the government to manage your care for the year. That means they're dependent on that government revenue, and they can't raise premiums to control costs like a traditional plan can. So what levers do they have to pull? Well, they can aggressively manage reimbursements to doctors and hospitals. That's why you see, like here in South Florida, that's why you see like Holy Cross Hospital and Humana, they're not working together anymore. If you're in Hollywood and you go to Memorial, you know that Florida Blue and Memorial aren't working together anymore. And these are some of the things that happen when the plans try to cut back and really control costs. At the same time, the hospitals and other providers are like, hey, our costs are going up. We need more money. Um, and then the other thing, all those extra benefits like dental, vision, those gym memberships that are really popular, well, those aren't guaranteed benefits. The only thing that's guaranteed on those plans are the core benefits. So another way that they can control cost is to start eliminating or reducing some of those core benefits. And in fact, a recent Reuters article that came out a week or so ago said that many of the big plan providers are planning to do this as we get into 2027. And of course, another way that they control cost, we saw that the last 2 years during open enrollment, is they stop offering PPO plans and start trying to shift people into HMO plans where they have more cost control levers that they can pull. People don't often feel the impact of network plans at the start. You usually don't feel the impact until months or years down the road when you actually need care. Another important concept, and this is especially important with Medicare supplement plans, are what are called risk pools. Every company has a pool of insureds in a given in a state, and they all price different ways. So some companies start very, very low, and they do that because they want to attract price-sensitive shoppers. Remember, with a Medigap plan, the plans are all standardized, so Plan G is Plan G no matter which company you get it from. The insurance companies, however, they're anything but standard. Some of them are going to price differently. They start low, they attract price-sensitive buyers, and then they know that after you've been on Medicare Part B for 6 months in most states, in order for you to change, in most cases, you're going to have to go through medical underwriting. So then they start raising rates more aggressively later to catch up, knowing that it's harder for you to switch. Other companies, well, they price more appropriately up front, so they look a little more expensive at the start, and they focus on long-term stability over time. The thing to remember with Medigap is you're not just choosing a plan, you're choosing how that company manages its business over time. And factors like customer service, claims loss ratio, claims payment timeliness, financial ratings, those are all going to come into play too. And this is an area where a good agent is going to have access to that data, and they're going to be able to show you that company's premium history over time and help you choose a plan that's more focused on stability rather than one that looks inexpensive up front but could leave you getting burned later on. Now, an area where I see frustration come in is, or where people get caught off guard, there's a couple scenarios actually. Number one, Advantage plan users, well, if they start to have more doctor visits, especially specialists, they're going to start to pay out of pocket. Or they're going to find that suddenly, doctors that they knew and trusted aren't taking the plan anymore. More specialists, more procedures, and suddenly those copays start to add up. The networks can start to feel a lot more limiting as they maybe can't get in to see who they wanted to see, or that doctor they thought was in the network isn't in the network anymore, or even a hospital, as in the case of like Memorial or Holy Cross. And how about all those people in Tampa recently that were on certain Medicare Advantage plans, were going to MD Anderson for cancer treatments, and their plan MD Anderson left their plan's network? Think of those people, and now they're scrambling and try to get care somewhere else. And then the other thing that happens on those plans, approvals become a lot more noticeable. Maybe they're having to wait for tests or treatments to be approved. Maybe a treatment gets denied. With the insurance companies through the pre-approval process, they can deny claims if they don't think it's medically necessary. So if it felt inexpensive, I hear this a lot of time, it felt inexpensive and easy until I actually needed it. That's a common statement that I hear from people that have Medicare Advantage plans that are thinking about switching. Now, another scenario, just as important, a lot of people will hear what I'm saying and say, yeah, that's great, I'm going to get a Medigap plan. But choosing a Medigap plan without having the right strategy can be just as big of a mistake, because what happens? Well, they're all standardized. So what do people do? They think, oh, standardized, I like Plan G, I like Plan N, I'm just going to go shop and find the lowest premium that I can find. Well, you don't have access to the same data that an independent agent does, so you're probably going to choose the lowest premium. but you're probably not going to know how stable that company is. And then what happens? Well, now you're dealing with bigger than expected rate increases, less predictability, difficulty switching later on when it gets expensive, or it may even be impossible for you to switch at that point, especially if you can't answer the company's health questions. Earlier this week, I spoke to a gentleman, and his Medicare supplement plan was scheduled to go up by over 20% in June. And he wanted to switch. We were able to switch him to a different plan. He was saving close to $100 a month. But as we went through the health questions, something in his medical history meant that he wasn't able to answer no to all the health questions, and he was uninsurable. So he missed out on that savings, and he's going to be dealing with that big premium increase. And by the way, this was the third year in a row he had dealt with significant premium increases, because that same company had gone up over 10% the past 2 years. The company that I was looking at switching him to had a bigger increase this year, because this is a big year for all Medicare supplement plans, but their increases the last 2 years were very, very reasonable. And that's an example of where premium stability really matters now more than ever. So let's look at what a better approach looks like. This is where strategy comes in. So a more thoughtful approach focuses on stability over time and not just the lowest price today. Now, that doesn't mean you should go and sign up for the most expensive Medigap plan in your area. You want to find one that's got a reasonable premium and a documented history of stability over time. And as you're working with an agent, they should be able to tell you that and tell you exactly what that company's rate increase history is. They should be able to tell you what their claims loss ratio is, because the loss ratio is the amount of money that that company spends on claims before they pay a dime of overhead. And higher the loss ratio, the more likely that premiums are going to go up, and go up significantly. Predictability is part of the strategy. You want to know what your costs are likely to look like, both upfront and down the road, because it's not just about protecting your monthly budget for today. It's about protecting your retirement savings down the road. A great example of that, and this question comes up in almost every conversation that I have about Medicare, is, well, what would you do if I was your mom? Well, my mom retired a few years ago, and my mom's living on a fixed income, so she couldn't really afford some of those large out-of-pocket expenses that can come up on certain plans. So when we put together her strategy, the most important thing for her was to protect her retirement savings. She could not afford to reach the maximum out-of-pocket limit on a Medicare Advantage plan. But then the other thing is, she's got some chronic health conditions. Now, they're very well managed, but she has a couple of key specialists that she needed to see. She lives in a rural area. There's limited primary care. So she also couldn't take the risk that somebody that she'd been seeing would suddenly go out of network and she'd have to travel a long distance to get care. So you put those together, and a Medicare supplement plan just made sense for her. That's what she's on. Yes, she's got a monthly premium, but you know what? She's on that fixed income. She can budget for that monthly premium every month, but then she can see any Medicare doctor anywhere in the country, go to any hospital. I mean, she can keep her doctors, keep her specialists, but it also means she's never going to be dealing with the type of surprise medical bills that can really wreck your retirement plan or wreck your retirement savings. Because remember, your retirement income's got to last for life. You're not working anymore. Yeah, and then the other piece of the strategy is structure first. So choosing how you want your coverage to actually work, not just what it costs. And that's exactly what I did with my mom when she retired. It's exactly what we do with each and every person that we help, each and every client. The goal isn't what's the cheapest plan. The goal is which plan works the way that you expect over the long haul. Many of the people that I work tend to prioritize freedom of choice, predictable costs, and limited out-of-pocket expenses, because they want to protect their retirement savings. They want fewer surprises as they get older, and when structured properly, people that choose that type of plan, it tends to hold up really, really well over time. There's going to be years where there's peaks and valleys in pricing, but when it's structured properly with a company that focuses on stability, that type of plan focuses really, really well over time. Now, if you're already on a plan that feels stable, if your costs have been predictable, you've been able to see the doctors you want, your out-of-pocket costs have been limited, that's exactly what we're aiming for. And it usually means that your plan was chosen with a long-term strategy involved. Almost everyone that I talk to has a retirement strategy, and you need to have a Medicare strategy to match. If you're approaching Medicare, or you've noticed your costs increasing and want to take a second look, or maybe you're helping someone who is approaching Medicare, my team and I would be honored to work with you. You can book an appointment at medicarequotes.com/Facebook. You can call the office, 954-970-4760. You can also just type in the comments, review, and I'll connect with you personally. Let's take a look at some of the common questions that I get. This one comes up a lot, and it's, why do some Medicare supplement plans increase more than others? It all comes down to how the company prices and manages risk over time. Some companies use a closed book strategy where they offer what I call low teaser pricing for a period of time, and then they essentially close that book of business. People that are left on that closed book start to see pretty significant increases because, you know what, there's no one being added to the risk pool. Meantime, they're going to open up maybe under another company name that they own. They'll open up a new book and rinse and repeat. Lots of big name companies, I could mention names and it would surprise you, but lots of big name companies actually follow this practice. Now, the alternative is a company who has a more realistic premium when you go to sign up, a premium that reflects their actual claims, who maintains what we call an open book. What's an open book mean? It means they just continue to keep that plan open and take new enrollees. That's the best approach because it's a wider pool of people. And we look for companies that have open books, that manage their business conservatively, and focus on maintaining stable premiums over time. Now, stable premiums over time doesn't mean that you're guaranteed that it's only going to go up a certain amount every year. I mean, it's going to ebb and flow. It's going to go up and down. But a company that manages their business for stability is almost always going to revert back to their historical level of performance over time when you look at them over a wide swath of time, even if they have a year where they have an abnormal premium increase. And with healthcare costs escalating the way they are today, having a company that focuses on stable premiums over time is more important now than it's ever been. Another question I get, are Advantage plans cheaper? A lot of people think that because they may cost less upfront, but the total cost depends on how you use the plan. In most cases, it can actually cost you more with an Advantage plan than it can with a Medigap plan, especially when you factor in not just the out-of-pocket costs that have to add up until you reach that maximum, but when you factor in all of the freedom that you're giving up. Remember, with original Medicare and a supplemental plan, you can go to any Medicare doctor anywhere in the country that takes Medicare. With an Advantage plan, you're limited to doctors that are in the network. A few weeks ago, I think I mentioned this on one of my last live calls, I spoke to a nice couple in Central Florida. He had been diagnosed with a serious pulmonary disease. They weren't my clients. They had signed up with another advisor when they turned 65. They've been on Medicare for a few years, but he was diagnosed with a very serious pulmonary condition. His doctors were all telling him, hey, you need to go to Mayo Clinic in Jacksonville. That's the best place to go to get the life-saving care that you need. Well, guess what? Mayo Clinic doesn't take most Medicare Advantage plans. So at that point, he wanted to get a supplemental plan. And in his case, they didn't care what the price was. They would have paid anything just to be able to get the life-saving care that he needed. And I felt horrible. This call stayed with me for a long time because I wasn't able to help him, because with that diagnosis on the books, he was already uninsurable. So that's an example of how Advantage plans can cost you more over time, not just financially, but in terms of the freedom that you end up having to give up. I get calls all the time from people who get sick and start to see how their Advantage plans work and they want to leave an Advantage plan. I've yet to get a call from anybody who's sick and has a Medicare supplement plan and wants to switch. Can I switch to a different plan if mine gets expensive? With a Medicare supplement plan, yeah, sometimes you can, but your options may be limited depending on the timing and depending on your health. Should I just pick the lowest Medigap premium? They're all standardized. No. It's important to look at how that plan is likely to behave over the long term. If it's an Advantage plan, what are the real out-of-pocket costs? What is the daily copay for an inpatient hospital stay? How much do you have to pay for an MRI for an outpatient surgery? How often do doctors leave the network? If it's a Medigap plan, what does their 5-year premium increase history look like? How long have they been in business? How are they rated with Standard & Poor's and AM Best? What's their claims loss ratio? Those factors are all going to drive premium expense on a Medicare supplement plan. A good Medicare advisor is not only going to go over those things with you, but they're going to appreciate that you're asking about them. Medicare costs aren't random. There's a number of factors that drive them, and there's something that most people don't fully understand at the beginning. But once you understand how plans behave over time, you're able to make much better decisions up front. Medicare Advantage plans, again, they've got limited levers that they can pull to deal with those costs. Medicare supplement plans, however, have the ability to raise and lower premiums in response to costs, and that gives them the ability to be more stable over time and continue to maintain the same level of benefits that you accept or that you expect. Well, thank you for being here. I hope you found this helpful. If you want help or you have questions, just go to medicarequotes.com/Facebook if you want to book an appointment. Call the office 954-970-4760 and we'll get you on the calendar, or just simply type review in the comments and I'll reach out to you personally to see how I can help. So I hope you have a great day, and I'll see you next Wednesday at 3 p.m. Eastern Time for Coffee with Casey.